We have a lab in our office. It is an outpatient procedure, and as soon as the tumor is removed from the patient, this piece is actually taken right back to our lab, which is right around the corner, and we have fabulous histotechnicians who then take the piece itself, they bisect it, and I brought some papers to kind of explain it if you want me to show you this. We'll use this as an example. We call stage 1 the first layer that we're removing, and we remove it almost in a saucerization, which I'll explain here. I brought an orange to explain it.
We're going to talk about that orange in just a minute.
I'm sure you were wondering why I brought it. So anyhow, we remove the cancer, and it's typically in the shape of a circle, but it's really just surrounding the tumor itself and the shape that the tumor is in. And in this case, it happens to be a circle. So we remove it in the shape of a circle, but before I do that, I make marks like a clock face on it. And it extends from the patient onto the part that I'm going to remove. So this double hash score, that's the 12 o'clock score, okay? 3 o'clock, 6 o'clock, 9 o'clock, okay? So it's removed just like that, okay? And I'll show you on the orange how that is done.
Yeah, let's pretend like this orange is my face.
Right.
And we've got a lesion.
Right.
And you're going to do, so you've got
it
marked off there.
And so this is what will be first stage, okay? And you can see the double hash mark there at the top, okay? Right about there. That is our 12 o'clock score, 3 o'clock, 6 o'clock, 9 o'clock, okay?
So you make a slice?
Right, because our cancer's here in the center, okay? And so this would actually be a much narrower margin, but for the purposes of discussing it with you, I made it larger. So this is actually removed, and I'll just show you. We've got a little handy scalpel here. And so it is removed. We go all the way around, okay? And then we pick it up with our forceps here. And we think, oh, we've got it, because you can't tell microscopically if it's there or not. But I did dye it purple, okay, to represent where tumor might still be, okay? And you can look at the underside of the orange here to see where the cancer actually still is, okay?
And you stain that. So you
I just stained that to explain it to you, but you can't normally see that under normal circumstances. It just looks like normal tissue, okay? So that's removed. I then take the tissue to the lab. It is frozen. It's cut on a special machine called a cryostat into micron thin pieces. They're very, very thin. Goes onto microscope slides. Those slides are then stained, and then I evaluate them under the microscope.
What are you looking for?
I'm looking for those cancer cells. They look totally different than normal tissue.
And when you find the cancer cells, how do you decide if you've made a big enough lesion on my cheek that had this cancer there?
Right. So if we see it, it's at the true margin, and we, make certain numbers of cuts in to know how far we are in margin-wise. But if it's there, it is at the true margin, and so I'm able to mark that because I can see those hash marks under the microscope, and I can say, oh, we've got some cancer here between, in this case, it was 9 and 12 o'clock and 3 and 6 o'clock. And so that's what the red represents, is the cancer that we saw under the microscope.
So if there's some cancer that's left there, what do you have to do
We have to take more, okay?
So same amount?
Well, we want to, of course, stay limited to only where the cancer is, right?
So you're going to, then you don't have to worry about 2 and 3 here, just 1 and 4.
You got it.
So you go a little bit deeper in those.
And wider, because this was so close to the skin edge in this particular case, okay? So we went ahead and we took a second stage here. Here's our 12 o'clock again, okay? And we're going to go ahead and take more and take more. This is super speedy. And then we'll remove our piece, which is much deeper than it normally would be because it's an orange.
Sure.
And then we look at it under the microscope, and we're found to have a nice, healthy, clean margin. Okay?
So, and that's what you're looking by. Clean, healthy margin, you mean?
No cancer.
And there's no cancer around there. You've gone through the whole thing.
Correct.
Whereas before, you can have an educated guess.
Correct.
But here, you're looking at it under the microscope. What's the cure rate?
It's up to 99%. It's the best cure rate that exists for a skin cancer.
So there's, to me, wow, no other way basically to do it other
Well, there are other ways, but certainly when it's the head and neck and sensitive cosmetic areas where you don't want to lose a lot of tissue, I think this is absolutely the method of choice.